What does the governor's proposed budget mean for hospitals and healthcare in Pennsylvania? Let's find out next on Behind the Headlines.
This is Behind the Headlines, with behind-the-scenes analysis on issues affecting Pennsylvanians, sponsored by the Susquehanna Valley Center for Public Policy. Now, here's your host.
Hi, welcome to a new edition of Behind the Headlines. I'm Charlie Greenewalt, Senior Fellow for the Susquehanna Valley Center for Public Policy, and I'm joined, as usual, by my co-host, Mara Donnelly. Mara, welcome.
Hello, Charlie.
Why, this is, we want to take just a moment here to have a reflection. It's very sad news at the passing of Mike Wallace, of course, the celebrated CBS newsman who I guess you and I watched as we were growing up. I used to watch him host a show called Biography in the late 1950s and early 60s. And of course from there he went on to 60 Minutes and made television history. And it's very rare to have a journalist with that much of an impact on public policy.
And one so well respected, too.
And on another sad note, we want to also recognize the passing of Charles Snelling of Allentown. Charles was a giant. He was a giant in the world of philanthropy. He was a giant in the world of public policy. He was a giant in the world of politics. He was a good and accomplished man who was well known throughout all of Pennsylvania, and we will all miss him, and our hearts' prayers go out to him and his family. Well, from that, we want to spend a little bit of time talking about healthcare today, Mara.
Yes.
And I think we are lucky today that we have one of the best people in the Commonwealth of Pennsylvania to talk about healthcare with us. It's a guest that we hasn't been with us for a little bit, but we're so happy that we can welcome her back to the show. And that is Carolyn Scanlan, who's the president and the CEO of the Hospital and Healthsystem Association of Pennsylvania. Carolyn, welcome to the show.
Thank you. Good to see you.
It's good to have you back. Why, Carolyn, since you haven't been with us for a little bit, we'd like to talk a little bit about your background. How did you? Where were you born? Where did you grow up? Was it in Pennsylvania?
Tell us about yourself.
I actually grew up in New York. My father had just returned from World War II and went back to college on the GI Bill, and I was born while he was in college. I am the oldest of four, and just about all of us, the oldest three, are in healthcare in some form.
Oh my goodness.
That's
the fourth,
interesting.
Is a businessman, and so
wow.
we often say that perhaps when we're old and gray, he'll take care of us. My parents stayed in New York, and I grew up in both upstate New York and Utica, New York, and then did most of my grade school and high school on Long Island. So I am, despite having now lived here for 17 years, I think people still call me a New Yorker.
Where did you go to college?
I also went to college in New York. I went to a small women's college called Skidmore. It's in Saratoga Springs.
Certainly, I know Skidmore very well.
And then I got married right after graduating from college, as did my husband, who just graduated from college. He went to a small men's college called Union. They were near each other, and we met while we were in school. And we lived in Albany. He went to law school. I went to work. He finished, joined the district attorney's office in Albany, New York, and I went back to school and got my master's at another small women's college called Russell Sage that had started a master's program in health administration.
Oh my goodness. Well, how did you make the trek down to Harrisburg then?
Well, the position of the then president and CEO was retiring, and there was a search, and I was asked to come in for interviewing, and so we moved here. I have two children, and one was 1.5 at the time.
Oh my goodness.
The other was in 4th grade. And my mother-in-law also moved with us. She moved into her own home, but we all moved in 1995. We came here.
Wow.
What attracted you to the field of healthcare, Carolyn?
Well, it's interesting. I had, at times in college, thought about going to medical school, but then concluded that it wasn't the right track for me. And so healthcare, health administration was always an interest. We had thought we would be in Albany, New York for a very short time, so I looked for a job. You know, Albany is like Harrisburg, the state capital, so you can find jobs with government. And my husband and I like to tell the story that my health career started because the New York State Health Department shared a parking lot with the law school. And we only had one car. And so I got a job in the health department. I mean, it really was something I wanted to do, but it was also very convenient for us.
And how long were you there before you ended up
I was in the health department for 15 years. I had 12 different jobs in that time period.
It's quite an apprenticeship.
It was. I kept moving into new areas and up in the organization. And then I joined the sister organization to our organization here in Pennsylvania, the Hospital Association of New York State. And its acronym is HANES. It's a really well-known organization. I joined in the number 2 position. In between the health department and there, I actually worked for a hospital that was becoming a health system.
Oh my goodness.
It was a Mercy system, St. Peter's. It is now part of a large East Coast health system, the Catholic Health East. And I did the clinical, ambulatory, and community services when I was there.
Wow.
So I have a pretty eclectic background. Is
Yes,
what I have.
You definitely served as your apprenticeship. Well, then you came to Harrisburg, and did you come in the top position?
I did.
From the onset.
I did. I came in as CEO. That's what I was recruited to be, and I was excited about coming to Pennsylvania. This is a state that has incredible hospitals. Medical schools, academic medical centers, and great diversity. If you look across the state, we have small rural hospitals serving their communities, and we have large, big teaching hospitals. And in between are the kinds of hospitals that people traditionally think of in their communities that take care of them from birth all the way through to death.
Are the problems that one finds in the New York hospital system similar to the ones in the Pennsylvania hospital system?
I think so. If you look across the country, I think that hospitals have been evolving fairly consistently across the country. You know, if you look back to when I came here 15 years ago, we had 240 mostly independent hospitals, and over the time period, hospitals have joined together to form health systems. They've joined together to better serve their communities, to be able to be more efficient, effective, make sure their quality and patient safety is of the highest level. And so that evolution that's occurring has been occurring across the country in every state.
Well, if you started here as many years ago, you've been through many administrations here, leadership at the very top of Pennsylvania, and I imagine that presents some particular challenges because every 4 or 8 years it changes, and you have to adjust to a new way of viewing hospitals and a new way of dealing with budgets. And what's been your fondest memory of of the various heads of state in Pennsylvania?
Well, you know, I'm on my 3rd governor now. Yeah. I came here very early on in the Ridge administration, so I saw about 7 years of Governor Ridge, 8 years of Governor Rendell, and now we're in the 2nd with Governor Corbett. You know, each administration has its own personality, its own characteristics, its own challenges when they put together a budget, and clearly this state has had challenges, particularly over the last 5 or 6 years, as has the rest of the country, as we've moved through the recession. The key, I think, though, and I think each governor and his administration grows to understand it, and clearly legislators understand it, that hospitals are a really important part of the economic fabric of the state. We employ, either directly or indirectly by a ripple effect, almost 600,000 people. We contribute $100 billion into the state economy. And in a predominance of the counties, 55 out of the 67, we're the top or within the top 5 employers. And so, you know, communities rely on their economic well-being. They rely on their employers, and in some instances, in whole counties, it is the hospital that really is the driver of the financial well-being of the county.
So when HAP speaks, people listen?
Well, we like to think so. We hope
Not always.
so. You know, there are lots of pressures on any governor and on the legislature. And if you think about all of the economic pressures that the leadership of the legislature, or all the legislators and the governor feel, it's pretty significant. But in this state, if you look at the kinds of economic engines that we have, it really is the healthcare or medical enterprises and education. I mean, those two comprise just about most of the employers in any community and in counties. Yes, there are other businesses, and you know, in Philadelphia and Pittsburgh, there's a renewal of business in many instances. But at the infrastructure of all of that is healthcare, and no business is going to relocate or stay in any area that doesn't have good healthcare and good educational opportunities for their employees and their employees' families.
Well, let's go back for a second. Hospital and Health System Association of Pennsylvania. How long ago was it established, and what was the reason for its establishment?
Well, you know, any group or affiliation together is to share information, to be able to be collegial amongst the leadership. And the Hospital Association was formed probably about 86, 87 years ago. It didn't have salaried staff the way we now do. It was a way for people to come together, share experiences, and talk about what they were doing going forward. Over time, with the evolution of hospitals as not only the deliverers of health care, but as economic enterprises, there was a need to come together to do education of their staff, a need for lobbying and advocacy, a need for the ability to also go to Washington and represent Pennsylvania hospitals with the Pennsylvania Congressional Delegation, which is what we also do. So over time, you know, there was a leader, executive director, now called CEO, that was hired, and then staff that was hired to do those kinds of functions.
We're going to talk in pretty good detail about some of the challenges you're facing from a budget perspective and an advocacy perspective, but second to advocacy, what's one of the biggest challenges facing the hospitals or your organization right now?
But you know, the world that we all live in continues to always evolve, and it's really clear in healthcare that there is a need for hospitals to come together with their clinical staff, with their physicians, with other hospitals in the community, and work on the care of patients in that long continuum that I talked about. You know, oftentimes people think of a hospital or a nursing home or at the end of life a hospice. All of those need to be interconnected, and we need to do a better job at the continuity of care from a patient all the way through his or her life in those processes. So one of the challenges is how to reconfigure that system to clearly make it more patient-friendly, make it easier to navigate, easier to understand, and as part of that, keep it affordable. Because one of the issues that people are concerned about is the cost of health care, which really means the cost of their health insurance premium, and the premium is a reflection of the whole health care system, not just the hospital piece. So working to put that configuration together and the care of the patients is really important.
Okay. Well, we'll be back to talk about those challenges that the healthcare system and the hospitals in Pennsylvania face with Carolyn Scanlan in just a minute. Stay tuned.
Behind the Headlines is brought to you as a public service by the Pennsylvania Business Council, envisioning a commonwealth in which residents enjoy a very high quality of life. in sustainable communities, the Council works aggressively to define key long-term policy strategies and solutions that make the Commonwealth more competitive, creating and sustaining a better Pennsylvania. Additional underwriting provided by the Worrell Corporation Foundation, based in Carlisle, Pennsylvania, by the Edward H. and Jeannie Arnold Foundation, and by the Hospital and Health System Association of Pennsylvania, helping hospitals to provide healing, health, and hope to communities across the state. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business. Behind the Headlines is also supported as a public service by Daily Express, transporting construction, farm, and industrial equipment throughout the United States. And by Penn Waste, your best local choice for your waste removal and recycling needs.
Welcome back to Behind the Headlines, and in the second half, Maura and I are going to continue our conversation with Carolyn Scanlan about hospitals in Pennsylvania and the challenges that they face. The one thing that I wanted to ask Carolyn was how many hospitals does Pennsylvania have, and are all of them members of the hospital, your association?
There are 180 acute care hospitals, and then additional rehab hospitals, psychiatric hospitals, specialty hospitals, so about 230 hospitals, and about 99% of them are our members. So we generally, when we speak, we really are speaking for Pennsylvania hospitals.
And I imagine they appreciate having an ally in Harrisburg, a representative in Harrisburg, someone that can do advocacy for them, someone who can obtain information when necessary from state government. And I imagine you fill many different needs.
That is the value of the membership in the organization, and our core function is advocating on behalf of the hospitals and the patients they serve. We really care about the communities in which our hospitals are in and the patients and the residents of those communities.
Well, you're going to have your work cut out for you this spring, I understand. The governor has proposed some significant cuts, probably on top of cuts that already have occurred over the last couple of years. So why don't you tell us a little bit about specifically what hospitals are facing in Governor Corbett's proposed budget at this point?
The proposed budget has 4 distinct areas, is how I like to categorize them. The first deals with changes that the governor and the secretary of the Department of Public Welfare have proposed for the current year, which is changing how the department pays for medical assistance newborn care. And it's pretty significant. In this state, interestingly, 50% of the births are Medicaid births. And that is a number that has significantly grown during the recession. Before the recession, pre-2008, it was about 1/3 of the births. So you can get a sense of the impact that the recession has had on mothers and children. The proposal is to just not pay for the normal newborn portion of that birth, and that's a problem for hospitals that offer obstetrical services.
And when you say normal newborn, you're talking about just your basic average, no risk, nothing went wrong type of birth,
standard
correct?
Birth,
Standard.
which is the predominance of births.
Right.
And so in the budget, it's proposed to cut about $5 million of state funds. Now, what's important to know is that for every dollar the state spends in the medical assistance program, the federal government matches it with $1.20, because it's a shared partnership state and federal program. So when the state says that they're going to cut $5 million, that's really almost $12 million when you add in the federal share and loss to the hospitals. So it's something that we have to always make clear. The second big area is just sort of straight cuts to hospitals, a 4% cut in the base payment rates, and 10% cuts in some special funds that go to hospitals that have trauma centers, again, obstetrical services, burn care centers, which are remarkably expensive enterprises, and hospitals called critical access hospitals, of which we have 13 in this state, and they are 25 beds or less. So those are important.
What constitutes a critical access hospital?
It's a federal designation. They have to be 25 miles away from another hospital, less than 25 beds, and essential in their community. So that's how those 13 got those designations.
Okay.
The budget also does a couple of other things which people have talked about, but don't necessarily understand the impact both on the individual and on the hospitals. So the third big area in the budget is the proposal that has been made to change what is called the General Assistance Program, which is a sub-piece of the Medical Assistance Program. Remember that medical assistance is health insurance for the poor. That's really what it is. And you know, we all have insurance through a private commercial company. Their insurance happens to be through a state and federal partnership. The state is proposing to do two things. One, the general assistance individuals are people who have temporary or permanent disabilities and receive some cash assistance from the state. It ranges from $100 to a couple $100 a month. Not a lot of money, but some. And in aggregate, for the 80,000 some odd GA individuals, it's $150 million. So the budget proposes to cut that fully. And change the threshold or the process on how people get determined to be general assistants. And so more detail on the administrative paperwork, the medical necessity pieces, and requiring people to work 100 hours a month. Now, that all sounds fairly reasonable, except these are people with temporary and permanent disabilities, such as being an inpatient psychiatric patient. You can't work 100 hours if you're an inpatient psychiatric patient, or even if you're outpatient with the kind of behavioral health problems that some of these individuals have. And so these are really very vulnerable people. And we worry about what will happen to them if they can't meet these criteria and they lose this medical assistance insurance. So they'll be without health care. For hospitals, that generally means these individuals will come to our emergency departments when they are more compromised than they otherwise might have been if we were seeing them. And that will be really difficult in the emergency departments. And for hospitals, it also means that we'll be taking care of people who aren't insured, which will raise our uncompensated care.
Of course, that's been true for years.
Well,
Carolyn,
and it's now up to $100 million a year that hospitals provide. It has grown during this recession, and this will cause it to grow even more.
Yeah. There's so many people in our society who just have felt over the years that if I'm sick and it's emergency, I can go to any emergency room and they will take me. The hospitals in many instances have borne the costs of many of those visits, and they've had to deal with it with their own resources. How much of a how long has that been an acute problem for the hospitals in Pennsylvania, Carolyn?
Well, you know, if you don't have access to a doctor, either because you don't have a doctor or because it's the middle of the night, people generally use the emergency department. Now, one likes to think of the emergency department as a place to go for trauma, for significant events. But we know that people use it for other reasons. And we just have been clogged up, is no other way to describe it. And the number of emergency department visits, those that are significantly acute and appropriate, continue to rise. So the emergency department really is the entry point for a lot of people into a hospital. We often think that we go to a hospital because we have elective reasons, but 60% of the people who are in hospitals come through the emergency department. So it's a pretty significant entry point. I just want to segue back to the fourth area.
I was going to make sure you did.
Yeah.
I think we only got 3.
Because we're talking about a vulnerable population. Okay. The fourth area is the proposal in regard to county aid. The governor proposes taking sort of 6 streams of funding that deal with behavioral health again, drug and alcohol treatment, the intellectually disabled, domestic violence, and a few others, merging them all into one major block grant and cutting it by 20%. That's $168 million cut from county funding. Again, hospitals aren't the direct recipient of those cuts, but hospitals contract with the counties to do some of those services. And again, very vulnerable people who, if the counties can no longer sustain the services or treatment that were funded by those individual grants, then we're going to see those individuals in the emergency departments also. And so it's really very troublesome, the proposed budget, for what I would call the most vulnerable in our population, both in the medical assistance, general assistance cuts, and in the county cuts. The governor talks in his budget address about making sure that there's a safety net for all the vulnerable people in the state. I think that this proposed budget sort of shreds that safety net, and the safety net ends up being the hospital's emergency department, which is not the place that people should be receiving care. These are people who need sort of basic, ongoing support and sustenance, and this will not continue that with the way this budget is proposed.
Well, as we're heading right into the thick of budget season here, and as an advocacy organization, what are some of the major steps you're going to be taking to communicate this information to the members of the General Assembly and to the governor's office?
Well, we've already started a conversation with the legislators, both our members back in their districts with their state senators and House members, us here in Harrisburg by visiting their offices, and conversations with the governor's office also. I think it's important for the governor and his staff and the Secretary of Department of Public Welfare to understand our significant concerns with the proposed budget. And so we brought that information to them. We actually have a website. It's called careforpa.org.
Okay.
People can go up on that website. They can see everything that I've now described verbally.
Can you repeat the website?
Yes, it's care for, not the number, but FOR, so careforpa.org.
Okay.
And they can go to a portion of the site where they themselves can send an email to their state senator, their House member, and the governor. And they don't even need to know who any of those people are. If they put their zip code in, the site will identify who those are for them.
So you've got a grassroots advocacy program going on, and our viewers can actually weigh in on this.
They can,
That's
and
awesome.
We'd love them to do that.
Okay.
They can either use the tailored message that we have on the website, or they can write their own message.
Okay.
In the last 30 seconds, what's the future direction that the association is going to take, Carolyn?
Well, we'll continue to advocate for our members, and we'll continue to make sure elected leaders, elected individuals, officials understand the importance of hospitals in their communities. We've talked about them as an economic engine.
Can you quickly just repeat those?
We employ 600,000 individuals, $100 million into the state's economy. I'm sorry, $1 billion. You got my numbers
I know,
mixed up.
I thought that.
$1 billion. Let me do it again. 600,000, $1 billion into the state economy in 55 out of the 67 counties, the top 5 employers in those counties.
That's quite an economic impact, yes. And we will be following your advocacy. We'll be following the budget as it goes through the stages. And we look forward to having you back very soon.
Thank you. I appreciate the time.
Thank you.
Thank you, Carolyn. And we'll be back next week for another edition of Behind the Headlines. We'll see you then.